Welcome back to the third and final part of the Veinpuncture collection lecture for MLT 110. Let's talk about assessing the liquid portion of the blood after your blood tubes have been spun down in your centrifuge. We've mentioned each one of these a little bit, but let's talk about each one more in detail. We're talking about hemolysis, icteric, and lipemic specimens. Hemolysis occurs when the red blood cells have lysed or broken open or burst and release their contents within a sample. And this will cause different degrees of pink or red to appear in your serum and plasma after the tube has been spun down in the centrifuge. Hemolysis can be a problem for your blood samples that are tested in the laboratory because hemolysis can have a negative effect on test results, making your test results inaccurate. And some of the tests that are possibly affected are your potassium results and your blood count. Let's look at the blood cell count, for instance. If the red blood cells have been lysed or have burst and no longer have the same shape that they normally would have under normal circumstances, your automated analyzers wouldn't be able to count them or to recognize them, so you would end up with a false decreased number of red blood cells. Next would be our icteric samples. These would be our samples that contain bilirubin. These would be our patients that could appear jaundice or have liver issues. The serum and plasma in these samples usually appear dark yellow to even orange. Sometimes they can even appear kind of a greenish color. Lastly would be our lipemic samples. These are our samples that contain excess lipids or fats in the blood. These, when spun down, the serum or plasma are going to appear milky in color instead of the nice straw light yellow color. Again, I mentioned earlier the serum could even appear kind of that strawberry milkshake color. On some of the coming slides, we're going to look at images and examples of all three of these different situations that can happen within a blood sample. Let's first look at some examples of hemolysis. Let's look at tube 1. Tube 1 is an example of what serum should look like. This is a normal color of serum, this light straw color, this light yellow color. And just to note, this is a tiger top tube. Remember I mentioned earlier the tiger top tubes are kind of a reddish orange and gray marble colored top. And you can see all along here, these are all tiger top tubes. And because these are tiger top tubes and these are serum tubes, we've allowed this blood to clot before we spun it down in the centrifuge. So once we spun it down the centrifuge, all the red blood cells have gone to the bottom, all the serum has gone to the top. One other thing to note about this tube is this particular tube has a gel separator within the tube. That is what this is here you see in between the red blood cells and the serum. And the purpose of the gel separator is just to keep a division between your red blood cells and your serum. Okay, so if tube 1 is our normal tube, this is the ideal sample, this is what we're looking for. Let's look at tube 2. What's the difference between tube 1 and tube 2? Look at the serum. After the tube has been spun down, the serum, it has a little bit of a red tinge to it or an orangish tinge. Well, what does this tell us has happened to the red blood cells? Well, some of the red blood cells have lysed or burst, and the red blood cells have opened up and released their contents, causing the contents to be released into the serum. That's what's causing this color change within the serum. So there is a little bit of hemolysis within tube 2. So moving on to tube 3, there is a little bit more hemolysis happening in tube 3, meaning more red blood cells have lysed. More red blood cells have opened up or burst and released their contents. All right, finally in tube 4, this is the most severe tube as far as hemolysis goes. See how dark red the serum is? This means a lot of red blood cells have lost and released their contents. So there's a lot of contents from the red blood cells that have been released into the serum. So all these degrees of hemolysis can affect some test results. Okay, let's look at some images of icteric samples next. Okay, the very first tube that's graded at a 0 for being icteric is right here. This one you don't see any of the dark yellow color, but it is just slightly pink, meaning it has just a few hemolyzed blood cells in it. So this would be a 0 for an icteric sample. This next one is a little bit darker than that normal light straw color. So this is slightly icteric. And then moving along up to this darkest sample. And remember I said with your liver patients, sometimes your icteric samples can start to take on kind of a greenish tinge. So anywhere from dark yellow to orange to kind of a greenish color can mean that it's icteric, or the patient might be suffering from some kind of liver issue. And in this particular image, we really don't know if this is plasma or serum, because from just looking at this image, we cannot determine what type of blood tube this fluid or liquid come from, because the liquid has been pipetted off the original tube. So it's been pipetted into a test tube. So this could be serum, this could be plasma, we don't know, but we can definitely tell that it is different in color and has different levels of being icteric. Okay, let's look at this image of lipemic samples. Again, we don't know if we're looking at serum or plasma samples because the samples have been pipetted off into separate test tubes from the original blood tubes. But the very first tube on the far left-hand side is an ideal sample for whether it's serum or plasma. You want to have this nice light straw colored or light yellow color. So this sample is not lipemic. Okay, the next sample, you start to have kind of a hazy color. So you're getting some fat or lipids in your sample. And then moving on over, it's a little bit thicker or more turbid. And then you just keep moving on over till you're kind of getting that opaque color. You cannot see through the sample at all. It's starting to resemble that kind of milky color I was referring to earlier. And sometimes you can have a sample that looks more pinkish in color. So it looks more like strawberry milk or a strawberry milkshake. Again, all three of these situations can cause negative or erroneous effects in your test results, whether it's the sample being hemolyzed, the sample being icteric, or the sample being lipemic. Something else we need to be aware of when we're completing phlebotomy is the concept of hemoconcentration. And this is when there's a buildup of analytes or cellular elements within the blood because of a tourniquet being tied on the arm or wherever on the body. And this can cause results to be inaccurate if the tourniquet is left on too long. Earlier, I said that we can usually leave the tourniquet on for about a minute to 2 minutes. It used to be pretty standard you could only leave the tourniquet on for a minute, but I think that's been pushed a little bit farther back to maybe around 2 minutes. And we use the tourniquet to make the veins more prominent in order to see the veins, in order to be able to complete the venipuncture. But the tourniquet being tied on the arm too long can interfere with the amount of plasma proteins, lipids, and sometimes can cause hemolysis in the specimen. So we just overall don't want to leave the tourniquet tied on too long. Some samples even require that you don't use a tourniquet or the tourniquet be released right before you collect the sample. And an example of that would be your lactic acid, because you don't want lactic acid to be built up and collected in the sample. Sometimes we have a negative effect of phlebotomy called a hematoma. A hematoma is basically a leaking of blood into the tissue. So excess blood is basically just leaking out under the skin, causing a bruise. And you can see an example of a hematoma here on this image. Of course, as a phlebotomist or a lab tech, we do not want to cause a hematoma, and we want to do everything to avoid it. But some of the reasons that a hematoma may form is that the tourniquet may not have been removed before the needle has been withdrawn, or the needle may have only partially been in the vein, so the vein may have leaked, allowing the blood to leak out under the skin, or the person completing the venipuncture may have adjusted or excessively probed the area in order to locate the vein. One trick that we can do that can sometimes help or prevent a hematoma or a bruise from forming is just to hold pressure for an extended amount of time on the puncture site, and hopefully that will help reduce the risk of a hematoma forming. This next slide is talking about hemolysis of samples again, and I'm not going to spend a lot of time on it because we've already discussed hemolysis in detail. But some things to note about hemolysis of samples is if you're drawing a blood sample with a syringe, if you pull too hard or too quickly back on a syringe for a blood draw, that can cause your blood cells to burst or to lyse and cause your samples to be hemolyzed. Also, if the needle is too small or the gauge of needle is too small, that can cause your red blood cells to burst or lyse and release their contents. Also, when you're mixing your tubes at the end of the venipuncture, make sure you're inverting your tubes. You don't want to vigorously shake your tubes to mix your tubes with the additives, because vigorously shaking the tubes can also sometimes cause hemolysis of red blood cells. Okay, sometimes inevitably in phlebotomy, you're going to stick a patient and you're going to end up missing a vein and you're not going to end up with any blood. So let's talk about what you're going to do in those type situations and how to prep for a blood draw. Okay, when you're prepping to do your blood draw, make sure that you have all your supplies within arm's reach when you're completing the blood draw. Even have extra stuff, because you don't want to have the needle in the arm and need an extra tube and not be able to reach it. It's also good practice to place your supplies on the side where you have your free arm. Let's say you're right-handed and you're holding the needle steady with your right hand, then all your supplies should be on the left-hand side, so you can easily grab your tubes, gauze, tape, whatever you might need with your free left hand. Remember I said the blood tubes have a vacuum pressure in them. They're called vacuum containers, but occasionally you will run across a blood tube that does not have that vacuum pressure. It's lost pressure for some reason. So if you feel confident that you're in the vein of the patient and you're not getting blood into your tube, the first thing you want to do is pull that tube off and try a second tube, because it may be that your tube has lost vacuum. So just try another tube. Okay, the next thing you might want to do if you're still not getting blood in the tube and you've changed the tube is you may want to change the angle of your needle in the arm. You might want to raise or lower. Remember, the needle in the arm needs to be about 15 degrees, no more than 30 degrees. We never want to vigorously probe the arm because we might hurt the patient, or we may compromise our specimen. We don't want to cause any hemolysis of our red blood cells. Another thing you can check is to see if your blood tube is properly seated on the needle itself. Remember, we have a double-sided needle. One side of the needle is the needle that's in the arm of the patient. The other side of the needle is the one that's in the blood tube. Remember, our blood tube has a rubber stopper that the second side of the needle has to penetrate in order to allow the blood flow from the arm into the blood tube. So make sure that your tube is not sideways and it's properly seated on that side of the needle. If you've done all these things to try to troubleshoot the venipuncture and you're still not getting blood, the next thing you can do is just discontinue the venipuncture. And when you discontinue the venipuncture and you pop the tourniquet and you remove the needle, you still need to apply pressure to the arm or the side of the puncture to stop any bleeding. Okay, so we talked about the veins of the arm briefly when we were talking about palpating the arms and trying to feel the veins of the arms, but let's talk about the locations of each of the arm veins. The cephalic vein is located on the thumb side of the arm, and this is the vein that's used most often when we're completing venipunctures. Then there is the median cubital, and this is the vein that's in the middle of the arm. And then finally there's the basilic. This is the vein that's on the pinky side of the arm, and it's very close to the brachial artery. It's not recommended necessarily for venipuncture just because it is close to that artery. It says here do not use, but we do use it if it's the one that we can feel best when we put on the tourniquet. Here's just a good image of the different arm veins. If you want to pause the video at this time so you can study the locations of the veins a little better, you can. When we're completing phlebotomy for certain tests, we have to complete certain special cleaning procedures. We already discussed special cleaning procedures for our blood culture bottles. We want to avoid contamination or skin contamination when we're collecting our blood culture bottles. Again, we're going to clean with either iodine or chlorhexidine instead of alcohol. And again, we're collecting 2 sets of bottles when we're collecting for blood cultures, and those blood culture bottles must be collected from 2 separate sites. For example, you can collect one from the left arm and you can collect one from the right arm. For our alcohol test or ethanol test that's tested in our chemistry department, we cannot use an alcohol swab to clean before the test sample is drawn because the test sample can be contaminated with the alcohol that is used for cleaning. So we must also clean with iodine or chlorhexidine, just like when we're cleaning for blood cultures, if we're collecting a sample for alcohol or ethanol testing. If we were to clean the site with alcohol and then collect a sample for alcohol ethanol testing, guess what? It can falsely elevate the alcohol results. Most adults can lose about 14% of their total blood volume without experiencing any major side effects in their vital signs. But if this amount is lost quickly, it may cause a feeling of dizziness or lightheadedness. The amount of blood that can be drawn from babies or infants is based on the baby's weight and total blood volume. There's a few different companies out there that make phlebotomy supplies, and depending on your clinical location or where you work, depends on which system they use for phlebotomy. The first system that you see up here is the one that we've talked about and seen examples about, and it's the most common one that you'll see in your clinical sites. This is the vacuum container system with the double-sided needle and the tube holder that you insert the tube in, and it's pretty bulky as far as what you hold on to. But there's also a system out there called the Starstead system. The Starstead system can be used as a vacuum container just like the first system, but it also can be used as a syringe. If you want to use it as a vacuum container, before you start the venipuncture, you just pull the syringe all the way back and then break the end of the syringe off, and it's a vacuum container. If you wanted to use it as a syringe, of course, you would just leave the end of the syringe on. The biggest difference between the vacuum container system and the Starstead system is the size of the tube holder. You see how much bigger the tube holder is versus the tube holder and hub for the Starstead system. You don't have near as much to hold on to. Some people prefer the Starstead system, some people prefer the vacuum container system, but we have clinical sites with both of these phlebotomy systems. The next concept we need to understand is contraindications. Contraindications is something that happens during collection that compromises the sample. A contraindication could happen for a number of different reasons. It could be that the tourniquet was left on too long and it compromised the sample. It could be that the phlebotomist accidentally drew from the wrong side of the patient when it was a mastectomy patient. Remember, you have to draw from the opposite side of the mastectomy. It could be that the blood was drawn from above a running IV. Remember, you have to draw from below a running IV. It could be that the patient drew from a patient that had a lot of edema. So there's a lot of reasons that there could be contraindications of a sample. And there's several complications that can happen during a phlebotomy draw. Of course, there's the possibility of bruising or a hematoma or your patient fainting. As a lab tech or a phlebotomist, there's going to be unavoidable mishaps or possible patient complications with blood draws. But it's important to be prepared no matter what happens. As a professional, you need to remain calm and you need to be ready to act in the best way to treat your patient. If the patient moves, remove the needle from the vein. Take action to care for your patient and to care for yourself at the same time. Immediately engage the safety of the needle once it's removed from the arm. Remove the tourniquet to get pressure off the vein. Apply direct pressure to the venipuncture site to help prevent a hematoma or bruising, and call for help if necessary. I hope you have learned a lot and have enjoyed part 3 of our venipuncture lecture. We will be practicing a lot in class and during lab time as far as tying the tourniquet, palpating to feel the vein, and practicing the venipunctures.